Well, I was doing the Lassa fever virus, and it was found in 1969 when two missionary nurses died from it in Nigeria, in the town of Lassa, which is why it was given its name. And it can also be found in west of African countries like Liberia, Sierra Leone, and of course Nigeria. And its host is the natal multi-mammate rat, also known as Mustonese rodent. Infection. The number of people who get infected by Lassa fever per year in West Africa are estimated 100,000 to 300,000, and it causes around 5,000 deaths annually. In areas like Liberia, 10 to 16% of people admitted into hospitals have contracted Lassa fever. The virus is a member of the Viridae, and is a single-stranded RNA virus that is animal-borne, so it's contracted by the rat. The way the infection is transmitted is through the rodent's urine or feces having contact with your system. Breathing in those feces particles as well can also contract it. If the rodent gets into food supply and sort of eats your food and you eat that, then you can also contract it. And also the rat is sometimes used as a food source, which you can contract it by. So the symptoms first appear after 1 to 3 weeks once the virus has had contact. In clinical illness, the onset is gradual with fever, malaise, headache, sore throat, cough, nausea, vomiting, diarrhea, myalgia, which is painful muscles, and chest and abdominal pain. Inflammation of the throat and eyes is commonly observed. Deeper problems have been described, including hearing loss, tremors, and initis. Because the symptoms of Lassa fever are so varied and non-specific, clinical diagnostics is often difficult. To treat this, you have to be given the drug ribavirin, an antiviral drug. It interferes with the viral replication by inhibiting RNA-dependent nucleic acid synthesis, which fights off the virus. However, by doing this, it has common side effects of the virus. The most complication of Lassa fever is deafness. Various degrees of deafness occur in approximately 1/3 of cases, and in many cases, hearing loss is permanent. As far as known, severity of the disease does not affect this complication. Deafness may develop in mild as well as severe cases. Spontaneous abortion is another serious complication. Approximately 15 to 20% of patients hospitalized for Lassa fever die from the illness. However, overall, only about 1% of infections with Lassa virus result in death. The death rates are particularly high for women in the third trimester of pregnancy and for fetuses, about 95% of which die in the uterus of infected pregnant mothers.
Thank you very much. Any questions for Ibrahim about Lassa fever? No? Thank you very much. A round of applause, please, if you would, for Ibrahim. Thank you.